This video will discuss key principles for intubation of a COVID-19 person under investigation or positive patient at Texas Children's Hospital. We are going to focus on key principles related to intubation specific for COVID-19 patients. We know that all of you are experts at intubation, and we will focus this video on things that are different or unique aspects related to COVID-19 patients. Our bedside nurse is assessing the patient in full PPE. Our patient has already been determined that they are in need of intubation, and the team is assembling outside of the room. Full personal protective equipment for all personnel taking care of a patient with COVID-19 is critical when preparing for intubation. We want to emphasize minimizing personnel during aerosolizing generating procedures. You will see the team preparing with their PPE outside of the room. Both the team that will remain outside of the room, as well as the team that will enter the room to perform the intubation. You will see our documenting nurse in this scenario is able to be outside of the room, connecting with the team inside the room via a Volt phone that is on speaker so that she can hear the medications and other interventions that happen in the room. Our huddling outside the room to prepare drugs, equipment, and other supplies needed, as well as to go through the procedure in detail to prepare the team prior to entering the room.
Just before we go ahead and intubate, my name is Dr. Lemke. I'll be the team lead. I'm going to be gowned and gloved, ready to go in after I put in N95 if you guys need me.
I'm Dr. Bastero. I'm going to be the physician intubating the patient. I will be inside the room, and I will use the CMAC if possible with RSI intubation sequence, and I will be gowning just to go in as soon as we finish huddle.
And I'm Cynthia, and I will be a PPE monitor, and I will also be ready and gowned up to go into the room if the patient decompensates. And at that time, I will put on an N95 and goggles.
I'm Gil, I'm the bedside nurse. I'll be administering IV administration. I'll have a great access to that AC.
I'm Nadia. I'll be documenting, co-narrator. I will be outside the room.
I'm Megan. I'm the pharmacist, and I'll be drawing up meds. And I'll be outside the room.
I'm Dexter. I'll be the outside RT. I'll be responsible for equipment and shuttling equipment in between the rooms. And Kayla.
I'm Kayla. I'm the bedside RT. I'll be inside the room assisting with the intubation.
I'm Maddie. I'll be outside the room, and I'm a runner.
So we can just go ahead and do that directly. We also have our CMAC ready to go in the room with is it a MAC tube?
Yes.
In place, we have our ventilator set up as well. We have our medication ready.
In addition, you will see our pharmacist preparing drugs and medications outside of the room. The airway supplies and medications are placed on a table on a clean chuck and brought into the room by members of the intubation team. The CMAC is preferred for intubation if possible. Inline suction should be set up and attached to the ventilator. The most experienced intubator
Team lead,
should be intubating.
So let's go and give 2 mics of fentanyl per kilo. Patient moving. Patient is not moving. They don't see chest rise. I'm gonna go up to the intubate.
Rapid sequence intubation with minimal or no bag mask ventilation is preferred. After tube placement, inflating the cuff before bagging will also minimize aerosolization.
Disconnect.
Careful disposal of all used supplies in the room is critical. The entire area should be cleaned with cabbie wipes. PPE should be removed and observed by the PPE monitor as you are removing your PPE. Gowns and gloves are removed within the room. Hand hygiene is performed for 20 seconds. Eye protection and N95 respirators are removed after leaving the room. Finally, hand hygiene is performed.